over time. Here's things that we look at. How do we detect if somebody actually has subluxations? Some of these things you're going to be able to look at on your own. I'm going to show you some things here. I'm going to talk to you about some things here that you might be able to detect this. Like, well, what if my kids have some different issues going on? You can look at some of these things and you can say, well, we should get them checked. Some of these is what we do in our office, which you won't be trained to do. The first one right here, it says 5 indicators of a vertebral subluxation. The first one is locked joint. So that individual segment, if we go back to this picture here, the individual segment here, if we have a lot of scar tissue that's formed in that segment, that one's not going to be able to move. So as we're feeling, it's called palpation, as we're feeling what's happening in someone's neck, in their joints, or in their back, we're trained to feel for motion. We're trained to feel when you have lack of motion. And so when you have lack of motion, go back to this one, that's a locked joint. It's a reduced segmental range of motion in feel. So it feels like it's locked up and it's stuck. We can feel that by what we're using here. We'll also look for asymmetry in global range of motion. So if you think about it, if you have one side of your spine that's locked up, that's not moving properly, that's going to affect how well you can turn. So you might be able to turn all the way to one side, no problem, but you not notice when you go to this side, it gets locked up and it's not moving. That tells us that there's a subluxation in your spine, because you have to have symmetry of motion, symmetry of posture, and alignment in your spine for your joints to be healthy. This is very important for infants and kids. You think about, a lot of times babies or infants, they'll only have their head turned to one side. And so they cannot turn back. So from the birth process, there's going to be so much strain and stress from the birth process. Scar tissue adhesions can bind and form in the muscles, the tendons and ligaments and joints, and they will not turn their head back over to the other side. Very important for infants to get that checked out to get proper stimulation to the brain. The third way they talk about here is misalignments. We'll be able to find misalignments. So let's say you had your head turned and you had an impact when you had your head turned. Well, your joints could get locked up in that turn position. X-rays are going to show us where those misalignments are. So that's another thing we do. Asymmetry of posture and muscle tone. Very important with this one. When I'm looking at someone's posture, what I want to see is that their spine, their shoulders are level, their head is directly over their rib cage is over their pelvis is over their feet. I'm going to do exaggerations here, but sometimes people come in, they feel like this is standing straight up and down, where one shoulder's higher than the other. Now, I know I'm exaggerating this, but even if it's a slight shift like that, or even the other direction, you can actually start to see there's going to be misalignments where the vertebrae in their spine are misaligned. You'll be able to see that by looking at their posture. Another thing you'll be able to see is their head can be shifted off to one side. They feel like this is normal. It's all because of misalignments in their neck. When you look from the side, you want to have their head back over their shoulders and rib cage over their pelvis, or pelvis over their feet. What's very common to see, which is very common to see with x-rays and when looking at posture, is our head starts to come forward, upper back, we start to hunch in the upper back. That can cause some serious problems for your body. And we're going to talk about those in just a second. But the last thing is allodynia. Allodynia means they have a non-noxious stimulus producing a noxious sensation. What that means is when you have areas that get locked up in your body, that are subluxated, that are not moving, that area becomes sensitive. So a non-noxious stimulus would be me actually feeling your neck. Like when I feel my arm here, that doesn't cause any pain, any discomfort at all. It shouldn't cause any problems to feel and to touch different parts of the body. My touch is a non-noxious stimulus. But if you have an area that's subluxated, that's locked up, that's not moving, and it's inflamed and irritated and the nerves are sensitive in that area, just me touching that area is going to cause a noxious sensation, which means you're going to feel pain. It's going to be tender. It's going to be uncomfortable for you when we touch that area. So these are indicators that we look at. Some of these you can look at, like the range of motion you can look at. You can look at the asymmetry of posture and muscle tone. And you can even oftentimes feel those different areas. It's like, oh, is that tender? Yeah. Oftentimes you'll be able to find right where that area is just by feeling. But that's something as a chiropractor we're trained to detect. Now, let me go to the next one here. If you have, we just talked about having inflamed, irritated joints. When a subluxation happens, you get inflamed joints, and what that does is that causes nociception to the brain. So nociception, again, think of somebody who's being obnoxious. So the prefix here, noci, N-O-C-I. Think of somebody as being obnoxious. That's somebody who's being irritating, who's being stressful, someone you want to smack around a little bit, right? So if you think about, if you have inflamed joints in your body, inflamed tissues, muscles, ligaments, bones, if you have inflammation around all of those areas of your body, that's not going to send healthy mechanoreception to your brain to drive proper brain function. That's going to send a noxious, irritated signal to your brain. Nociception is that signal going to your brain. And what I want you to know is this can be going to your brain, this nociception can be going to your brain for years and you not actually feel pain. It can be going to your brain for years from your neck. Say you have a subluxation in your neck, nociception could be going to your brain for a long time before you actually consciously say, ow, my neck hurts. Ow, my neck hurts. Or ow, my low back hurts. That could be there for many, many years before you actually feel the pain. Just like we talked about before, 37% of 20-year-olds have degeneration. 96% of asymptomatic 80-year-olds have arthritis and degeneration in their spine. That's sending nociception to your brain. Now here's what nociception does. Nociception stimulates what's called the fight or flight response. It stimulates your sympathetic nervous system and it gets you ready for fight or flight. So let's go through some of those. Subluxation, here's some research on this. There is this different journals. The Journal of the American Osteopathic Association, Forensic Science International, Autonomic Neuroscience, Alternative Therapies, and Health Medicine. These are 4 different studies that show that subluxations, that segment that's locked up in your spine, which is very, very common, even in asymptomatic people, increases the central nervous system, the CNS, central nervous system, sympathetic tone. Increases your sympathetic nervous system. Here's what this says. Hyperactivity of the sympathetic innervation as a common factor in disease. What all of these studies are showing is that if your sympathetic nervous system is on overdrive, if it's constantly in a fight or flight situation or stimulus, that is at the root of virtually every illness, is a common factor in virtually every disease that we know today. Heightened sympathetic nervous system is at the root of virtually every illness known today. And each one of these journals is talking about that. And this subluxation, that nociception, that noxious stimulus to your brain is increasing your sympathetic nervous system, increasing your chance for every single illness known to man. Now again, it's not the sole cause of every single illness and disease, because your diet's important, your thoughts are important, exercise is important, the people you surround yourself with are important, all those things are important. But it is contributing to, because it increases your sympathetic nervous system. So let me show you a couple others here. Here's some things that happen during the sympathetic nervous system, during the stress response. You have increased cortisol. I'll talk about these in just a second. I'm going to go through this and then I'll talk about it in just a second. Increased cortisol, increased catecholamines, those are stress hormones. Increased heart rate, increased vasoconstriction, increased blood pressure, increased clotting factors, fear, anxiety, and depression increase, decreased short-term memory, ability to concentrate and learn new material is decreased, decreased serotonin levels, which is your feel-good hormone, increased noradrenaline levels, increased cellular immunity. Decreased cellular immunity, so it decreases your immune system. So let me describe it this way. I think it's easier to understand if you describe it this way. Let's imagine, first of all, that every single person watching this, myself included, we're all afraid of bears. And there's a big grizzly bear that comes into your house right now, and that bear is looking right at you. You're in a position in between that big mama grizzly bear and its cub. So you know it's mad. It's also a hungry grizzly bear. So there's certain things that's going to happen inside your body physiologically that's going to be the stress response, because your brain's going to perceive that as a stressor, and it's going to cause your pupils to dilate. You want your pupils to dilate really big That way you can hopefully find an escape route. That way you can pay attention to everything in your surrounding, so you can find an escape route to get away from that bear, or if you need to try to fight that bear. That's why it's called fight or flight. But you think about what's going to happen to your heart rate. Your heart rate's going to start pounding. Your heart rate's going to start pounding. Your blood pressure's going to go up. You want those things to happen, so that way you have the fuel and the energy. You're getting all that energy to your brain, to your muscles, which is glucose, which your blood sugar is going to go way up, because your brain uses sugar for energy. Your muscles use sugar for energy. So if a bear's here, you want to fight that bear or run from it. So it's very important for your blood sugar to go up. Now, when you think about learning new material, if a bear's here, you're not going to be able to learn, calculus. You're not going to be able to learn quantum mechanics or physics. You're not going to be able to remember your grocery list. Those things are not important for survival of that short-term situation. So those things are out. But again, your ability to pay attention to all of the details in your surrounding are heightened. That way you can find an escape route. That way, if you hear a twig break over here, maybe there's another bear over there, and you need to be alert to that. So you're going to be paying attention to every single thing in your surrounding, which is very smart. All of the blood flow, you have increased vasoconstriction. All of the blood flow go into your organs, your stomach, your liver, your pancreas, your spleen, all those organs. The blood flow is going to be shut off. And you want that to happen because your organs are not going to save your life in that bear attack, especially if it attacks you. It's not going to save your life. You're not worried about digesting your salad or your steak or whatever you're eating. You're not worried about digesting any of those things. You need those things to be shut down, and you need all the blood to your muscles and to your brain to be increased to get that blood sugar out there so you can fight or you can run, flight. You also want your body to shut down your immune system when a bear is here. Your immune system requires a lot of energy to run. So think about the last time you had a cold or flu, so you were sick. Most of us, all of us actually, will be very lethargic, exhausted. We're going to stay in bed all day. We're not going to have tons of energy to get up and go run around. And the reason why that is because your immune system requires a lot of energy to run. And when the bear's here, in that fight or flight situation, you need all of that energy for your muscles and for your brain to fight that bear or to run from it. You do not want your white blood cells. Your white blood cells are not going to beat off a bear. But you do not want your immune system to be overrun that drags you down and wears your energy out so that you cannot fight the bear. It's not important for saving your life in that situation. All of the LDL cholesterol and other blood clotting factors in your platelets and things in your blood are going to go up. Very, very important if you're in that situation. Because again, if the bear scratches you, LDL cholesterol and other clotting factors will go and clot that wound to save your life. So again, beautiful response. If you think about sex drive, your sex drive is going to decrease when that bear is here. You're not thinking about hanky-panky. That is not going to be something that's a good survival strategy if a bear's here and you're getting aroused. That's just not going to be a very good survival strategy. So all of those things are shut down. So in that moment, that's an excellent response because that can save your life. And if you didn't have that, we probably wouldn't be existing today. Human beings would be gone. We'd be off this earth because we need that for survival. But the problem with us today is we have that stress response every single day, all day long. So what happens if you have that bear in your life? That bear could be a subluxation in your spine. That bear could be a bad diet. That bear could be negative thoughts. That bear could be poor posture, on and on and on, a sedentary lifestyle. It just gets on and on, it piles on and on and on. And what's happening is you're causing this response. So if you have a stress response every single day of your life, increased heart rate, increased blood pressure, increased LDL